It is time for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, happy to be with you, Dave. Good morning, everybody.
Boy, it is a beautiful, beautiful day today. We'd like to have many, many, many of these, and you're going to talk a little bit about longevity today.
Absolutely. Longevity is a fancy word for saying we want longer living and we want good quality living. So we want both. And, the Western medicine way typically has done a great job with extending lifespan in some capacities, but sometimes the quality portion, we miss a little bit on that number. So that's what we aim to do when we come to the Okoboji Wellness Clinic, is find that balance, and it has something to do specifically with another fancy word called telomeres. And telomeres are the end of a chromosome, and that correlates the length of those with lifespan. And so the shorter those are, the shorter the lifespan. So the interesting thing, back in the day we learned in American history and geography and such, was Ponce de Leon looking for the fountain of youth. And one of the ways to find that within oneself is to augment that telomere length, increase the size of it. And it is definitely possible, and it's definitely doable in a manner that is very holistic and very gentle on the body. And the three things that we really work on here at the clinic, of course, is the hyperbaric therapy. Oxygenation, we find whenever there's low oxygen in the body, that's going to cause some problems in the body, and including chronic disease. So that's why the hyperbarics, we get into that hyperbaric chamber, compress the air, and we increase the oxygen saturation around your body, so there's more oxygen dissolved in a smaller space, and that increases that saturation in the body. So, of course, we need oxygen. It's fuel for the brain, fuel for everything in the body, and that absolutely will increase with hyperbaric therapy. So, and that also is going to work on extending that telomere length at the end of the chromosome. So a lot of times we're again, when we talk about this thing called a biohack or longevity, we are really focusing in on, and we've talked about this too, Dave, in the past many, many times, how important movement of the body is and the nutrition part of it is. So again, if we're doing all these great things on one end with the hyperbarics and other nutraceuticals and such, and we miss the movement of the body and we miss the nutrition part, different things that are inflaming our body, not having those in our body, such as sugar, in some cases gluten for folks, amongst many other things that we're exposed to, heavy metals and so on and so forth, the work is a lot bigger of an uphill climb. So it's a combination of work of all these things together to get the body back into symmetry. But two big things, and not many people check nitric oxide. We've touched on it in the past. That's another key ingredient outside of hyperbaric therapy to increase the longevity, increase that telomere length, is nitric oxide, which is a gas. It's formed in the body, and it's really, really good to decrease inflammation, increase oxygen flow. It vasodilates blood vessels, so it increases blood flow to the body. Many times very effective at lowering blood pressure. And so nitric oxide, other really key thing, we've touched on it in the past with regard to proton pump inhibitors, heartburn, antacids, those things. Guess what? Those things have been shown to decrease the activity of telomerase, which is an enzyme that is meant to lengthen the telomere. And so you are actually inhibiting or slowing or the growing of that telomere when you're on that antacid. And part of the reason it's doing that is because it's effectively shutting down or decreasing nitric oxide production, that gas we talked about. So again, hyperbarics, number 2, a big one. And this is kind of, I've got a top 5 or 10. This might be my top 3, the nitric oxide. And we measure that. You come into the clinic, wherever there's lack of blood flow to the body, we can improve that with these things. And it's just a little test on the tongue, and we'll see if it pops. Most folks are popping up depleted in the nitric oxide category. We're finding folks even in their 20s are starting to be low in it, and that's a bit concerning. Good news is we can address it. So the nitric oxide, and the third big one, Dave, is glutathione. Glutathione is some folks will call it vitamin G. They think it's that important that we should add another vitamin to the menu of categories. This, not vitamin C, vitamin D, but vitamin G. Glutathione, it's an antioxidant, and so it reduces inflammation in the body. It helps with the digestive tract, the leaky gut. It helps also increase the telomere length, and so it's helping, again, with longevity. It pulls heavy metals out of the body. It helps hyperbarics work that much better. So again, when we're talking about working with folks on chronic disease, inflammation, and balance, these 3 things are 3 huge boosters to the body, to the balance, to decreasing the inflammation and increasing oxygenation, that are just a fantastic trio that really, it's amazing combination. And a lot of times when we talk about all these combinations, we talk about synchronicity. So I will have some folks that will come in and say, well, how do we know which one's working? Well, if we're inflamed and we're not feeling well, a lot of folks will say, I just want you to throw the kitchen sink at it. And the synchronicity, many times when you add these different parts together, the sum together outweighs them individually by themselves. So that's many folks will come in for extended stays with us. That's what we do for that 2 to 3 week period. Many times we are adding all of the secret ingredients together and putting a nice little mixture that is personalized to that individual's needs that comes here, and then we see what comes out on the other end, which is improved quality, less inflammation, and just more hope and happiness.
Since we've begun our Wellness Wednesdays, one theme continues to come up, and they are kind of part of the puzzle to getting not only better but living well. And the 2 common things that just continue to keep coming up, because you mentioned the proton inhibitors. Is that the right terminology? Mm-hmm. Okay.
Yeah,
so,
proton pump inhibitors. Yeah.
Okay. So we started talking a little bit about gut health, and we've talked over and over and over again about inflammation. And so when you combine gut health and inflammation, these 2 things seem to come up all the time to getting better.
Those are two big deals. And the gut health, the inflammation, again, brain then also is big time tied to gut. A lot of times we say leaky gut, leaky brain. Mm-hmm. And so the combination of folks that are coming in feeling the brain fog and the lack of energy, even the stuff on the skin, we're tying it back in many cases to what's happening in that gut. So that's kind of the gatekeeper. If that gets out of balance, then everything else can tend to get sideways.
Well, and I'll tell you what, some of these people, I follow on diets, nutrition, things like that, because I think that's new, coming to the forefront. And these people, for the most part, they're pretty low on sugar, because there's just a massive segment of the population that's insulin resistant. And so these people have figured out that if they can diet with less sugar, less carbs, which turns into sugar, Some of these people's lives are being dramatically changed with nutrition.
Oh my goodness, it's dramatic. I've got such a great story of a gentleman that is doing just that. I mean, he came in with an A1C, or an average blood sugar, of 9. And that's a blood sugar average over 3 months. Diabetes, technical diagnosis of that is over 6.5. And he was bound and determined he was going to cut weight, and he's in his 60s, and he was going to get this down with a few supplements, and just as you said, cutting out the sugar, and reducing his carb intake dramatically and getting into what we call ketosis. I've worked alongside him. He's self-motivated. It's such a pleasure to see. I almost bet his A1C is going to drop down, and I'll give an update. I bet it will drop down to under 6 in a matter of 3 months. That's just dropping 3 points is unheard of. But he's like, I'm wearing clothes I haven't worn since high school.
Oh.
And he's dropping pant sizes. He shoots me a text once in a while. This morning he sent me a text saying my blood sugar was 87, and normal fasting is under 100. And his, when he came in and we identified this, was in the 200s for in the morning. And so it's very doable.
Yep.
When we know what to do. So,
Yep.
And it's not all that complex. It's just taking the time to work with folks to get you down the right path. So,
all right, we're going to run out of time, but we got a quick hope story. You've got somebody actually all the way in from Wyoming.
Yes, he's a beautiful soul, and he used to spar with Joe Frazier in the boxing realm, and we're working on some brain with him, and he'll be here for 3 weeks. So anything like, so he just, it's just, again, I get kind of sort of get choked up talking about all these stories, but he's just so grateful to be here. And so prayers sent his way. He and his lovely wife are here for 3 weeks, and we plan to get him his mobility returned, to get to work towards that brain recovery, because he had a traumatic event last spring. And so I hope to share more about his progress over the coming weeks as we move forward. So he's already, after a couple hyperbaric treatments, having decreased pain and sleeping better, and insomnia has been a big deal for him, not sleeping well. So good start already, and more to come. So
awesome. All right, so people, if they want to come see you, talk about longevity, talk about feeling better, not just getting better, but living well, how do people come see you, or at least get a hold of you?
Yeah, absolutely. You know, sometimes we have folks just stop in. We had a couple folks yesterday and saying, hey, here's some exciting stuff's taking place there, and we give them a quick tour. We're at 3305 Berquist Avenue in Spirit Lake, just off Highway 71. You can reach us at 712-339-6024. And I've got an amazing team here that is ready to get working with you on the journey. They can also get you scheduled with a discovery call with me. It's 15 minutes on Wednesday afternoons, complimentary, to kind of go over a little bit about what's going on with you and how we may implement kind of a game plan to get going with getting your inflammation down, your oxygen level up, checking that nitric oxide, getting you going on vitamin G, antioxidant, glutathione, and possibly some hyperbaric therapy, amongst many, many, many other things. So that's how you can reach us, Dave.
Very good. Dr. Meyer, always a pleasure. Have a great, great day, and we'll chat soon.
Sounds great, Dave.
Thank you.
Be well, everybody.
Thank you, Dr. Bradley Meyer. Okoboji Wellness Clinic on another edition of Wellness Wednesday. You can find them online as well, okobojiwellnessclinic.com.